Hello, my name is Carrie Baker. I am the President and CEO of Health Impact Ohio. We are lucky enough to serve with the Ohio Department of Health for the Community Health Workers for COVID Response and Resilient Communities Grant.
Hi, my name is April Rillo, and I work at Goodwill Easter Seals Miami Valley, located in Dayton, Ohio, and I work with the Dayton Regional Pathways Hub.
My name is Donna Youngblood. I am a certified community health worker. I work under the Agency of Child Guidance and Family Solutions, and I also am a part of the Akron Hub.
My name is Christine Lattimore. I work for United Way of Greater Cleveland in conjunction with Better Health Pathways Hub for Cuyahoga County.
My name is Madison Moore, and I work at the Tuscarawas County Senior Center with the Bridges to Wellness Hub in Dover, Ohio.
My name is Mary Peavy, and I work with ProMedica Community Care Hub here in Toledo, Ohio, and I am a part of the Northwest Ohio's Pathway Hub here in Toledo, Ohio.
Hi, my name is Wendy Holloman. The organization that I'm with is Primary One Health, and that's here in Columbus, Ohio. The hub that I'm with is with the Central Ohio Pathways Hub in Columbus, Ohio as well.
The CDC CCR training has been really impactful in my work as a CHW. All aspects of the training were really helpful, but I think the greatest benefit was that we were exposed to information directly from providers themselves and those who've been working with the most up-to-date information from the pandemic.
It's given me the latest info, the latest information, like with COVID, to connect with my clients.
You guys give so much good information about what's going on with COVID at the time. You bring on a lot of good guest speakers that give us an inside look at how other things are. So that's a big help for us.
Most of us are not constantly immersed in the data, and most of us don't work directly with patients in the ER with these severe symptoms and complications. So it's been wonderful for me and my current work to feel confident that the information that I'm giving to my participants is accurate, easy to digest, and also driven by compassion and understanding for their personal concerns and life experiences.
The COVID pandemic has changed my role as a CHW as where I am able to both be inbound and work with clients virtual and to be one-on-one, to sit with them one-on-one on any type of basis, whether it's in the community, at a doctor's appointment, or anything, whatever is comfortable for the client, I can do versus everything just being one-on-one where it's face-to-face. Some people are not comfortable doing things face-to-face, where it allows me to work in any form, fashion for them.
Well, the COVID pandemic hasn't really changed my role. The only thing it really changed was my in-person visits. I continue to be the same community health worker, helping my clients through. I did my face-to-faces through Google Duo, which was amazing because they were able to see who I was. They were able to understand and see the passion, the love, the concern, my genuine heart for what I do.
The influx of clients that I have received has changed drastically. I went from serving maternal and adult population to serving some pregnant clients on my caseload. But with that being said, with the training that we've received, it has allowed me to educate each and every one of them and present to them the information in a way that they're able to understand it and are able to relate it to their family members.
So one of the biggest barriers to the clients I work with in accessing care and resources about COVID-19, it's a bit of a paradox, I think, because we live in a time where all of our questions can pretty much be answered on our phone with our preferred search engine. But a lot of the barriers that I'm seeing every day are comments like, my brother posted a video, somebody got the vaccine, it's magnetized, it might be a microchip. And then other concerns about like reactions, physical reactions after somebody gets the vaccine. And all of those concerns are so valid and so real that I can understand and empathize with where it comes from.
We have so many hospitals, we have tons of drive-in clinics, pharmacies that give them out. It's just that people don't want to get them. People believe in our area so many conspiracy theories, and we're a very rural area. So to try and talk to people about it, it's very hard to cross over that barrier. Sometimes you just feel shut down right away. So I think that's we have so many resources to do it. It's just people don't want to take the resources to get it done.
I believe it is not knowing, them not having the information in front of them, and not knowing that, again, as I said, about the testing kits, about being able to go to different sites and different places to get the shots.
Seeing that their fear stems from a very real place, but also acknowledging from a community health perspective that the evidence, the data does more than suggest that COVID vaccines are not only life-saving, but they're the best chance that we have right now to protect families.
The most impactful thing that I have learned with CCR training is there are multiple ways to connect to people. It was actually a great reminder, but being a social worker as well, it reminded me of how you have to relate with a client, and it's so many different ways.
The education on the vaccines, of telling and breaking it down, even for me as a community health worker, to be able to break down the barriers for my clients to get the COVID vaccines, and not to push them, not to threaten them, but to just enlighten them on what they were afraid of, what impact it may have on them.
The training has really helped remind me of what works for every individual within the county of Cuyahoga.
Something that I have learned about my clients that might surprise people. I used to believe in that old saying that you can't teach a dog new tricks. In the last few years, I have realized that people absolutely can change. I think that we sometimes tell ourselves that they can't because it's easier than actually having to dig in and do the work, as challenging as that can be.
A lot of people are professionals. They are doctors and nurses and teachers, everyday people. With this being a program for individuals that in order for you to qualify, you have to be on Medicaid. The pandemic has taken a lot of people off of regular and private insurance. So this allows people to see actually what is out here and to spread the news that Medicaid actually has a lot of benefits to it. And you're a regular individual. You don't have to be poor to be on Medicaid, literally. And when you fall into tough times, this is available for anyone.
They are human. I always let them know that we do have our struggles, and it's just a chapter in their book. They'll be able to turn that chapter in that book and say, well, you know, I made it past there.
The things that I like most about the CCR CDC training is hearing other people's stories, what they use to kind of interact with their clients' tools.
We discussed everything from equity mapping tools to how to improve community needs assessments. But even more than that, we went to how to work with those in minority groups who have been like traumatized generationally by maybe those in the medical community, to differently abled individuals, and then how to get them the best information that they need as it pertains to COVID.
As we go on, just being able to use the data mapping and that data equity tool that we're using, that we haven't heard about in some of our trainings, I really think that's going to be an exciting piece for us to use for the work and for the people that we are serving in our community.
At every single one of these trainings, or if I haven't been able to come to one and I'll watch the recording, I'm just, yes, we talked about disabilities. I love this. Like, it's been great.
Hi, I'm Tanika Price. I'm the Director of Education at Health Impact Ohio, And I just wanted to talk a little bit about the benefit of the CCR trainings. So in our CHW certification program, we offered the Friday CCR trainings as sort of an extra way that our CHWs could be educated specifically about COVID-19 and the pandemic. I think one of the benefits was that we were able to offer them information as soon as it was happening. Things were changing so quickly, and really we didn't know who to turn to. The CHWs didn't know who to turn to, and certainly our clients didn't know who to turn to or believe. So as CHWs are trained to be trusted messengers, it was so important that we equip them with the latest and most accurate information. We wanted to make sure that we could debunk all of the myths that were circulating about COVID and about the COVID vaccinations. So we partnered with Partners in Health, and luckily we were able to have the most brilliant minds who were working on COVID-19, the research, the immunizations. We were able to have them come in and speak directly to our CHWs and supervisors. It was just invaluable. It put them at ease about the information and the messages that they were carrying to their clients. And also, I believe it put them at ease and helped them, made them more likely to get the vaccinations themselves, because they trust us to give them the best information. And they know that we're going to do our due diligence to partner with information, giving places that are accurate. And so I think it helped everybody to be safer. It helped us to get PPE out and know that people were going to be able to utilize that in a correct manner. And also it helped us to increase the numbers of vaccines amongst our clients and amongst our CHW. The CCR trainings were invaluable for getting us through this year with the COVID-19 pandemic and lockdown. And it's going to be so vital to continuing to educate our CHWs in the future.
I think for me personally, as well as for us as an organization, seeing the impact that our community health workers, not only in the Central Ohio Pathways Hub, but in all the hubs across the state are making, makes all of the work worthwhile. To see the education that they're providing, to see that the hope that they're giving clients, to see all of the pathways that are closed, which inevitably means that risks were mitigated, is the most inspiring thing for me, and I think for all of our team, and I hope for everybody that interacts with their community health workers statewide.